Hello and welcome to today's lecture on a critical and timely subject, the intrinsic link between health and economic development in Canada. This presentation aims to dissect how the health of a population is not merely a social outcome, but a foundational input for a nation's economic vitality and growth. We will explore various dimensions of this relationship, from the direct costs of illness to the long-term benefits of a healthy workforce. Our focus will be exclusively on the Canadian context, drawing on specific examples, policies, and data that highlight the unique challenges and opportunities within our healthcare and economic systems. We will delve into how investments in public health and healthcare infrastructure can yield significant returns in productivity, innovation, and overall societal well-being. This lecture is designed to provide a comprehensive overview for students and professionals interested in public health, economics, and policy, offering a multifaceted perspective on a topic that is central to Canada's future prosperity. We will consider the provincial variations in health outcomes and economic indicators, the role of federal policy, and the impact of demographic shifts. The discussion will be grounded in current research and empirical evidence, providing a robust framework for understanding these complex interdependencies. This slide delves into the historical foundations of the health economy nexus in Canada. Before the modern era, health challenges were significant barriers to economic development. Early Canadian settlements and urban centers faced recurring epidemics of diseases like smallpox, cholera, and typhus. These outbreaks were not merely public health crises, they were severe economic shocks. They crippled labor forces, disrupted trade, and drained community resources. The response to these challenges provides insight into Canada's evolving understanding of health as an economic asset. Early public health measures, such as the implementation of sanitation systems in cities like Montreal and Toronto, were not just about improving well-being. They were strategic investments to prevent disease, stabilize the workforce, and enable sustained economic activity. For example, the establishment of quarantine stations at major ports like Gros Isle in Quebec was a direct response to the economic imperative of protecting the nascent Canadian economy from imported diseases. These early efforts demonstrate a fundamental recognition that a healthy population is a prerequisite for a thriving economy. Without a stable and available workforce, industries could not grow, resources could not be extracted, and commerce could not flourish. The early focus on infectious disease control, while rudimentary by today's standards, laid the conceptual groundwork for a national approach to health that would eventually lead to the establishment of universal healthcare. The challenges of the past, from managing large-scale immigration-related health issues to adapting to the demands of an industrializing society, mirror in a scaled-down way the complex problems Canada faces today in linking health and economic policy. Canada's universal healthcare system, established largely through the Medical Care Act of 1966, represents a foundational economic policy disguised as a social program. The economic argument for the system is multifaceted. By eliminating financial barriers to access, it ensures that citizens can seek care early, preventing conditions from worsening and becoming more expensive to treat. This preventative approach is far more cost-effective in the long run than a system reliant on emergency care. Furthermore, universal healthcare acts as a significant economic stabilizer. It protects individuals and families from catastrophic medical costs, which could lead to personal bankruptcy and widespread financial instability. A healthy and financially secure population is more likely to participate in the labor market, consume goods and services, and contribute to the tax base. The system also enhances labor mobility. A Canadian worker can move from one province to another without fear of losing health coverage, which is critical for a diverse and geographically expansive economy. This portability encourages a more efficient allocation of labor resources across the country. The economic benefits extend to increased productivity. Workers who are confident in their ability to access care are less likely to take time off due to preventable illness, and when they are ill, they are more likely to return to work faster. This boosts overall economic output. The system also promotes health equity, reducing the economic drag caused by health disparities between different socio-economic groups. This long-term investment in human capital is a key pillar of Canada's economic model. Chronic diseases represent a substantial and growing economic burden in Canada. Conditions such as heart disease, cancer, diabetes, and respiratory illnesses not only affect individual health but also impose immense costs on the healthcare system and the broader economy. These costs can be categorized as direct and indirect. Direct costs include all expenditures on medical services, hospital care, medication, and long-term care. Indirect costs, which are often overlooked, include lost productivity due to absenteeism, premature death, and a reduced capacity to work. For example, a 2019 report by the Canadian Diabetes Association estimated that diabetes costs the Canadian economy billions of dollars annually. The cost is not just from treating the disease itself but from managing its complications, such as kidney failure, blindness, and amputations, all of which require extensive and expensive medical interventions. A case study might look at a province like Ontario, where the aging population is increasing the prevalence of these conditions. Effective public health policies focusing on prevention and lifestyle modifications, such as campaigns against smoking and promoting healthy eating, can have a high return on investment. The economic savings from preventing even a small percentage of new diabetes cases would be significant, freeing up resources for other health priorities and keeping individuals active in the workforce longer. The challenge lies in shifting from a reactive, illness-based system to a proactive, prevention-focused model. Mental health has emerged as a critical factor in Canada's economic health. Mental illnesses, such as depression, anxiety, and burnout, are major contributors to absenteeism and presenteeism, reduced productivity at work. The Mental Health Commission of Canada has estimated the economic cost of mental illness at over $50 billion per year, a figure that includes lost productivity, healthcare costs, and caregiver burdens. This is a staggering figure that underscores the need for a national strategy. A key aspect of this is the recognition of mental health as a workplace issue. Many Canadian companies are now implementing employee assistance programs, EAPs, and other wellness initiatives. A return on investment (ROI) analysis often shows that for every dollar invested in mental health programs, companies can see a return of $2 to $4 in increased productivity and reduced disability costs. For example, a study of a large Canadian telecommunications company might show a direct correlation between the provision of mental health benefits and a decrease in sick days and long-term disability claims. Furthermore, the economic implications extend to the healthcare system itself, with increased strain on emergency rooms and long waiting lists for psychological services. Addressing this issue requires a coordinated effort between government, businesses, and healthcare providers to create a supportive environment that recognizes mental health as a vital component of both individual and national economic prosperity. The healthcare workforce in Canada is a significant economic engine in its own right, employing millions of people and contributing substantially to the GDP. However, shortages in key professions, particularly among family physicians, nurses, and specialists, pose a serious threat to both health outcomes and economic stability. These shortages create long wait times, burnout among existing staff, and a reduced capacity to treat patients, leading to sicker workers and lost productivity. The economic costs are not just in salaries, they are in the ripple effects across the entire economy. A worker who cannot get a timely appointment for a chronic condition may have to take more sick days, or worse, end up in the emergency room, which is far more expensive. The issue of brain drain, where Canadian-trained healthcare professionals move to the United States for higher salaries or better working conditions, also represents a significant economic loss on a national scale. The investment in training a doctor or nurse is substantial, and when they leave the country, that investment is lost. Policy solutions must be multifaceted, from increasing training capacity at Canadian universities to creating incentives for professionals to work in underserved rural and remote areas. The economic health of Canada is directly tied to the health of its healthcare workforce, making this a critical area for strategic investment and policy reform. Health infrastructure, from large urban hospitals to small rural clinics, is a vital component of Canada's economic landscape. These facilities are more than just places to receive care, they are major employers, consumers of goods and services, and anchors of local economies. Building a new hospital, for instance, creates thousands of construction jobs, stimulates the local supply chain, and once operational, provides long-term employment for a wide range of professionals, from doctors and nurses to administrative and support staff. This direct economic impact is significant. Moreover, modern, well-equipped facilities contribute to better health outcomes, which in turn support the wider economy. A hospital with state-of-the-art diagnostic tools can treat patients more efficiently, reducing wait times and enabling a quicker return to work. In many small towns and rural communities, a local clinic or hospital is one of the largest and most stable employers. A lack of adequate infrastructure, on the other hand, can act as a barrier to economic development. Companies may be hesitant to invest in regions with poor access to quality healthcare, as it is a critical factor for attracting and retaining talent. Therefore, investments in health infrastructure are not just health expenditures, they are strategic economic development tools that can foster long-term growth and stability across different regions of Canada. Health disparities in Canada are not just a social justice issue, they are significant economic liability. When certain populations, such as Indigenous communities or those living in rural and remote areas, have worse health outcomes, it creates an economic drag on the entire nation. For Indigenous populations, systemic health inequities, rooted in historical and social factors, result in higher rates of chronic disease, lower life expectancy, and reduced participation in the labor force. This loss of human capital and economic potential is immense. A study on the economic costs of health inequities in First Nations communities, for example, could reveal billions of dollars in lost productivity, increased healthcare costs, and a reduced tax base. Similarly, the urban-rural divide in health access and outcomes contributes to economic disparities. Rural communities, which are often the backbone of Canada's resource and agricultural sectors, face challenges in accessing specialized care, which can lead to poorer health and hinder their economic development. Addressing these inequities through targeted health and social policies is not just a moral obligation, it is a pragmatic economic strategy. Investing in Indigenous-led health services, improving rural healthcare access through telemedicine, and addressing the social determinants of health are all measures that would yield both social and economic returns. Canada's health sector is a hub of innovation, with a strong potential to drive economic growth. Medical research, biotechnology, and the pharmaceutical industry are key components of this. Canadian universities and research institutions are at the forefront of discoveries in genetics, drug development, and medical devices. The commercialization of these innovations can lead to the creation of high-value jobs, attract foreign investment, and boost exports. For example, a successful startup in the field of diagnostic medical devices can not only improve patient care but also create a new industry with global market potential. However, Canada has historically struggled to retain the economic benefits of its research, with many innovations being commercialized in other countries. Policy initiatives that support domestic commercialization, such as venture capital funds for health technology startups and streamlined regulatory processes, are crucial. The development of a robust health tech ecosystem, centered in cities like Toronto, Vancouver, and Montreal, could position Canada as a global leader. This would have a significant ripple effect, attracting talent, fostering a culture of innovation, and strengthening the knowledge-based economy. The synergy between a strong research base and a supportive policy environment is essential for translating health innovation into tangible economic growth and a more resilient national economy. The COVID-19 pandemic served as a dramatic and stark case study of the profound and immediate link between public health and economic stability. The initial health crisis, the rapid spread of a novel virus, immediately translated into an economic crisis. Lockdowns, travel restrictions, and business closures, while necessary public health measures, led to unprecedented economic disruption. The costs were staggering, including billions of dollars in lost GDP, mass layoffs, and disrupted global supply chains. The pandemic highlighted the economic value of a robust public health system. Countries with stronger public health infrastructure and a more coordinated response were, in many cases, able to contain the virus more effectively and, in turn, mitigate the economic damage. In Canada, the swift implementation of income support programs like the CERB and CEWS was an economic necessity to prevent a complete collapse of the consumer economy. The experience also underscored the importance of health data. The use of real-time epidemiological data was crucial for making informed economic policy decisions. The pandemic taught us that investing in public health preparedness, from vaccine research to contact tracing systems, is a strategic economic investment. The lessons learned will inform Canada's future economic resilience, emphasizing that a healthy population is the ultimate safeguard against large-scale economic shock. Canada's population is aging, and this demographic shift presents both a significant challenge and a potential opportunity for the economy. The primary challenge is the increasing demand for healthcare services, particularly in long-term and geriatric care. The costs associated with an older population, who tend to have more chronic health issues, are putting pressure on provincial healthcare budgets. This trend is not a sudden crisis but a long-term demographic inevitability that requires strategic planning. The economic implications are multifaceted. As the proportion of retirees grows, the labor force participation rate may decline, and the dependency ratio will increase, placing a greater burden on the working population to support the healthcare system and pensions. However, a healthy aging population is a powerful economic asset. Many older Canadians wish to remain active in the workforce longer, volunteer, or start new businesses. Policies that support active and healthy aging, such as promoting physical activity and providing mental health support, can help keep this demographic engaged and contributing to the economy. The development of a financially sustainable elder care system, which may include a mix of private and public funding models and a focus on home-based care, is crucial. This demographic shift requires a national dialogue on how to balance the social and economic needs of an aging society. Investments in public health initiatives, while often seen as social expenditures, provide some of the highest economic returns. The most obvious example is vaccination. An immunization program against diseases like measles or influenza not only saves lives but also prevents widespread illness that would otherwise lead to massive absenteeism from work and school, overwhelming hospital systems, and significant economic disruption. The cost of a vaccine is minuscule compared to the potential economic losses from an epidemic. Similarly, health promotion campaigns, such as those encouraging smoking cessation or healthy eating, can prevent chronic diseases, leading to long-term savings in healthcare costs and increased productivity. For example, a campaign by the Public Health Agency of Canada to reduce smoking could result in billions of dollars in long-term healthcare savings by reducing rates of lung cancer and heart disease. These preventative measures are a form of economic insurance. They protect the workforce, ensure the stability of the healthcare system, and allow businesses to operate without interruption. This approach is fundamental to Canada's economic resilience, as it shifts the focus from treating illness to maintaining wellness, which is a far more economically sound strategy. Individual health is a cornerstone of economic security. For most Canadians, an unexpected and serious illness can be a source of immense financial stress, even with universal health care. While the direct costs of medical care are largely covered, families still face indirect costs, such as lost income from time off work, caregiving expenses, and the financial burden of managing a long-term illness. A catastrophic health event can deplete savings, force early retirement, and lead to financial instability. The social safety net, including employment insurance and disability benefits, plays a crucial role in mitigating these economic shocks. However, these programs are often not enough to fully offset the financial impact. This reality underscores the need for policies that strengthen the link between health and economic security. A healthier population is a more financially stable one, as individuals are more likely to be employed, earn higher wages, and save for the future. This contributes to a robust consumer economy and a strong tax base. The link is circular. Economic security can lead to better health outcomes by providing access to better nutrition, housing, and social support, which in turn reinforces economic stability. Caregivers, often family members or friends, provide an immense amount of unpaid labor that is crucial for the Canadian healthcare system and economy. They care for children with disabilities, aging parents, and chronically ill relatives. This work, while uncompensated, has a significant economic value. A 2017 study by the National Institute on Aging estimated that the value of unpaid caregiving in Canada was in the tens of billions of dollars annually, representing a significant portion of the total healthcare system. However, this work comes with a cost to the caregiver. Many have to reduce their working hours, take extended leaves of absence, or even leave the labor force entirely. This results in lost wages, reduced retirement savings, and a drag on overall economic productivity. From an economic perspective, this is a significant inefficiency. Government support for caregivers, in the form of tax credits, benefit programs, or paid leave, is not just a social measure, it is a smart economic policy. By supporting caregivers, the government can help them remain in the workforce, maintain their economic independence, and reduce the strain on the formal healthcare system. Recognizing and monetizing the economic value of caregiving is a critical step towards a more equitable and productive economy. Canada's vast geography and diverse population mean that health outcomes and healthcare access vary significantly across provinces and territories. These regional disparities have direct economic consequences. For example, a province with a higher rate of chronic disease may face higher healthcare costs and a less productive workforce, which can hinder its economic growth. Federal transfer payments, such as the Canada Health Transfer, are designed to help provinces and territories provide comparable levels of health services, but the disparities persist. The economic viability of a region is intrinsically linked to the health of its population. A region with a strong and healthy workforce is more attractive to businesses and investors, while a region with a sicker population may face challenges in attracting talent and investment. The policy challenge is to develop targeted, regional solutions that address specific health needs. This could include investments in telemedicine to serve remote communities, or public health campaigns that are tailored to the cultural and social context of a particular region. By addressing regional health inequities, Canada can not only improve the well-being of its citizens, but also unlock the economic potential of every part of the country, leading to a more balanced and prosperous national economy. Technology is a powerful tool for integrating health and economic policy. The adoption of digital health records, for instance, can streamline patient care, reduce administrative costs, and improve data sharing between healthcare providers. This increased efficiency has a direct economic benefit by reducing unnecessary procedures and preventing medical errors. Telemedicine, which became widespread during the COVID-19 pandemic, is another example of a technology with significant economic potential. It can reduce travel costs for patients in rural and remote areas, decrease wait times, and allow healthcare providers to see more patients in a day. A Canadian case study might show how a telemedicine program in a Northern Territory reduced patient travel costs and improved access to specialized care, leading to better health outcomes and a more productive local economy. However, the adoption of technology in the Canadian healthcare system has been slow and fragmented, due to privacy concerns, regulatory hurdles, and a lack of interoperability between different provincial systems. Overcoming these challenges is crucial for unlocking the full economic potential of health technology. The strategic investment in and widespread adoption of these technologies will be a key driver of Canada's future economic growth. A healthy workplace is a direct contributor to a healthy economy. The economic case for investing in employee wellness is strong and well documented. Workplace wellness programs, which can include things like gym memberships, mental health support, and smoking cessation programs, have a high return on investment. A study by the Canadian Centre for Occupational Health and Safety, for example, might show that for every dollar invested in wellness programs, companies can see a return of $2 to $3 in reduced absenteeism, increased productivity, and lower healthcare costs. Furthermore, robust health and safety regulations, enforced by provincial and federal agencies, are not just about protecting workers, they are about protecting the economy. Workplace injuries and illnesses result in lost productivity, increased insurance costs for businesses, and a strain on the healthcare system. The legal and financial costs of a workplace accident can be substantial for a company. By prioritizing health and safety, businesses can create a more resilient and productive workforce, which in turn contributes to a more competitive and stable national economy. Canadian corporate leaders are increasingly recognizing that employee well-being is not a nice-to-have but a strategic business imperative. Food security, or the lack thereof, is a critical social determinant of health with clear economic implications. In Canada, a significant number of households experience some degree of food insecurity. This lack of access to affordable, nutritious food is directly linked to higher rates of chronic diseases like diabetes, heart disease, and hypertension. These health issues lead to increased healthcare costs and reduced productivity. A case study might look at a northern Indigenous community, where food costs are prohibitively high due to transportation challenges. The resulting food insecurity leads to higher rates of diet-related illnesses, which place a significant burden on the local healthcare system and hinder economic development in the region. The economic costs are not just in healthcare, they are in the lost human potential and reduced quality of life. The policy challenge is to address food insecurity through a combination of social programs, agricultural policies, and local initiatives. By ensuring all Canadians have access to healthy food, the government can not only improve public health but also reduce long-term healthcare costs and foster a more productive workforce. This is a fundamental step toward building a more resilient and equitable economy. Environmental factors are a major determinant of public health, and their economic impact is significant and growing. Air pollution from industrial activity and transportation, for example, contributes to respiratory illnesses, cardiovascular disease, and cancer. The healthcare costs associated with these conditions, along with the lost productivity from sick days, represent a substantial economic burden. A study on a major Canadian city could quantify the economic savings that would result from a reduction in air pollution. Climate change is a new and growing threat to both health and the economy. It can lead to more frequent extreme weather events, which can result in injuries and displacement. It can also increase the prevalence of vector-borne diseases and heat-related illnesses. The economic costs of these health impacts are immense. However, environmental regulations are not just a cost, they are a form of health and economic policy. By reducing pollution and mitigating climate change, Canada can reduce long-term healthcare costs, protect the workforce, and spur innovation in clean technologies. This is a classic example of a win-win scenario, where investments in environmental protection yield both public health benefits and long-term economic gains, positioning Canada as a leader in the green economy. Canada's immigration policy is a key driver of its economic growth, and the universal healthcare system is a powerful factor in attracting and retaining skilled immigrants. Unlike many countries, Canada's system provides new immigrants with access to quality medical care, which is a significant selling point for professionals and families considering a move. This access to healthcare reduces a major source of financial risk and stress for newcomers, enabling them to settle more quickly, integrate into the labor market, and become productive members of society. A healthy immigrant population contributes to the economy by boosting the labor supply, filling key skills gaps, and increasing consumer demand. Furthermore, health screening as part of the immigration process is a pragmatic economic measure to ensure that new arrivals do not place an undue burden on the healthcare system. A strong healthcare system is a competitive advantage for Canada in the global race for talent. It signals to the world that Canada is a stable, secure, and welcoming place to live and work. By leveraging its healthcare system as an economic asset, Canada can continue to attract the talent it needs to fuel its future prosperity. The health of a population is a critical factor in the speed and robustness of an economic recovery from a recession. A healthier workforce is more resilient to economic shocks and can return to work faster, accelerating the rebound. Conversely, a population with widespread health issues, such as those caused by a pandemic or a general decline in public health, can hinder a recovery. This is because a sick population is less productive, consumes fewer goods and services, and places a greater burden on social support systems. Health spending itself can also act as a form of economic stimulus. Investing in health infrastructure, research, and public health programs creates jobs and stimulates demand in related industries. During past Canadian recessions, government health spending has played a stabilizing role, providing employment for millions of healthcare workers and ensuring a basic level of economic activity. Furthermore, public health metrics can be used as leading economic indicators. A decline in public health, such as rising rates of chronic disease or mental illness, can signal future economic challenges. The lesson from past economic downturns is clear: health and economic policy are deeply intertwined. A coordinated approach that uses health spending as a strategic tool for economic recovery is essential for future resilience. Indigenous communities in Canada face profound health and economic disparities rooted in historical and ongoing colonialism. These disparities are a major obstacle to the economic development of these communities and, by extension, to the overall Canadian economy. The social determinants of health, such as poor housing, inadequate sanitation, food insecurity, and a lack of access to clean water, directly contribute to chronic health issues and reduced life expectancy. These health challenges hinder labor force participation and entrepreneurial activity, perpetuating a cycle of poverty. For example, a community without a reliable source of clean water cannot build a tourism industry or support a local restaurant. The economic impact is immense, representing billions of dollars in lost productivity and increased healthcare costs. However, there is a growing recognition that Indigenous-led health and economic initiatives are the most effective way to address these issues. By supporting self-determination and funding Indigenous-run health centers, Canada can empower communities to develop solutions that are culturally relevant and effective. This approach not only improves health outcomes but also strengthens community governance, builds local economies, and fosters a more equitable and prosperous future for all Canadians. Canada's economy has historically been driven by its vast natural resources, including forestry, mining, and oil and gas. The health and safety of workers in these sectors are not just a regulatory concern, but a critical economic factor. Work-related injuries and illnesses, such as lung diseases from mining or accidents in logging, result in significant economic costs. These include lost productivity, increased workers' compensation premiums for businesses, and a strain on the healthcare system. A study might look at the economic costs of an outbreak of a respiratory disease in a mining community, which would lead to a halt in operations and massive financial losses. Robust occupational health and safety regulations, enforced by provincial and federal governments, are a direct investment in the long-term economic viability of these sectors. By ensuring a safe working environment, Canada can protect its workforce, reduce business costs, and maintain a competitive advantage. Furthermore, a healthy workforce is more productive, more innovative, and more resilient to economic shocks. The link is clear: protecting the health of workers in the resource sector is essential for protecting the economic health of the sector itself, and by extension, the entire Canadian economy. Urban planning is a silent but powerful determinant of both health and economic vitality. The design of a city can encourage or discourage physical activity, influence air quality, and determine access to healthy food options. A city that is designed to be walkable, with parks and public green spaces, promotes active lifestyles, which in turn can reduce rates of obesity, heart disease, and diabetes. This has a direct economic benefit by lowering long-term healthcare costs and creating a more productive workforce. Conversely, a city with poor urban planning, characterized by heavy traffic congestion and a lack of green spaces, can lead to higher rates of respiratory illness, stress, and a reduced quality of life. The economic costs of traffic congestion alone, in terms of lost productivity and wasted fuel, are significant in major Canadian cities like Toronto and Vancouver. By incorporating health-conscious principles into urban planning, such as creating bike lanes, investing in public transit, and zoning for mixed-use neighborhoods, Canada can build cities that are not only more livable but also more economically resilient. This is a strategic approach to using urban policy as a tool for public health and economic development. Investment in health research is a key driver of Canada's knowledge-based economy. The discoveries made in laboratories and research centers across the country have a significant economic impact, far beyond their immediate health benefits. Research creates high-value, well-paying jobs for scientists, technicians, and support staff. It also attracts international talent and students, who can contribute to the Canadian economy long after their studies are complete. A study by the Canadian Institutes of Health Research, CIHR, a major government funding body, might show that every dollar invested in health research generates a significant economic return through a combination of job creation, spin-off companies, and long-term healthcare savings. For example, a breakthrough in cancer treatment developed at a Canadian university could lead to the creation of a new pharmaceutical company, which would employ hundreds of people and generate significant tax revenue. Furthermore, health research enhances Canada's reputation as a global leader in innovation, making it more attractive for foreign investment. This is a clear case where public good, research, is also a powerful engine of economic growth. Looking ahead, several key trends will shape the nexus of health and economic development in Canada. The continued digitization of healthcare is paramount. The widespread adoption of electronic health records, telemedicine, and remote patient monitoring will not only improve access to care but also reduce administrative costs and increase efficiency. This technological shift will be a major economic driver, particularly in remote and rural areas. The growing recognition of mental health as a critical component of economic productivity will lead to increased investment in workplace wellness programs and community-based mental health services. The economic benefits of this investment, in terms of reduced absenteeism and increased productivity, will be substantial. The economic impacts of climate change on public health are another major trend. As Canada faces more frequent extreme weather events, the costs of health-related emergencies will rise. Investing in climate adaptation and mitigation measures is not just an environmental policy, it's a critical health and economic policy. Finally, the rise of personalized medicine, driven by advancements in genomics and data analytics, holds immense economic promise. By tailoring treatments to individual patients, it can reduce healthcare costs, improve outcomes, and get people back to work faster. These trends require a coordinated and forward-looking approach to health policy that recognizes its central role in Canada's future economic prosperity. This slide lists the key references that inform the content of this lecture. Each entry is a seminal or highly relevant source that provides data, analysis, and conceptual frameworks for understanding the complex interplay between health and economic development in Canada. The notes for each reference provide a brief summary of its significance and why it was selected for this academic presentation.